A groundbreaking study has unveiled the optimal exercise regimens for individuals with type 1 diabetes. Conducted by the Universidade Federal do Vale do São Francisco in collaboration with Staffordshire University. This research aims to address the challenges faced by diabetic patients in managing their condition through physical activity, particularly focusing on blood sugar fluctuations. Dr. Puya Sultani from Staffordshire University emphasized the significance of the study, noting that many diabetic patients struggle with motivation to exercise due to potential blood sugar drops. These drops can lead to discomfort and demotivation, making it crucial to identify exercises that minimize such risks. The study sought to determine if specific types of physical activity could mitigate these adverse effects. The research involved 19 participants with type 1 diabetes who engaged in 2 randomized trials to assess glycemic and cardiovascular responses. Each participant completed 30 minutes of moderate aerobic exercise on a treadmill. The interval aerobic session alternated between 1-minute intervals at 40% and 60% of estimated maximal oxygen consumption, or VO2 max. In contrast, the continuous exercise was performed at a steady 50% of VO2 max. Researchers measured heart rate, blood pressure, and blood glucose levels before, immediately after, and 20 minutes post-exercise. Additionally, they evaluated rates of perceived exertion and enjoyment levels to gauge the participants' experiences. The study revealed intriguing insights into how different exercise types affect blood glucose levels. Both interval and continuous exercises showed similar cardiovascular responses, perceived exertion, and enjoyment levels across genders. However, notable differences emerged in blood glucose responses between male and female participants. Men experienced greater reductions in blood glucose levels immediately after and 20 minutes following continuous aerobic exercise, as well as immediately after interval exercise. Conversely, women exhibited reduced blood glucose values only after continuous exercise. These findings underscore the importance of tailoring exercise prescriptions to individual needs, particularly to prevent hypoglycemia, a condition characterized by dangerously low blood sugar levels. Dr. Jorge Luis de Brito Gomes from Universidade Federal do Vale do São Francisco highlighted the gender-specific recommendations derived from the study. For male patients, interval exercise, such as short bursts of walking, is preferable when starting with low blood sugar levels. On the other hand, continuous exercise, like running, is more suitable for those with higher initial blood sugar levels. These tailored approaches can help prevent sudden blood sugar drops. For female patients, both interval and continuous aerobic exercises appear to be effective starting points. The study advocates for gender-specific recommendations in aerobic exercise prescriptions, especially for men with irregular physical activity levels. This study provides valuable insights into optimizing exercise regimens for type 1 diabetes patients. By considering gender-specific differences, healthcare providers can better tailor exercise prescriptions to individual needs, enhancing the management of blood sugar levels and overall well-being. These findings pave the way for more personalized and effective exercise strategies for diabetic patients.